Truth will challenge your conviction of what you truly believe in. What truth will do, it'll have you tossing and turning. Truth is meant to convert you. If you're here today, you just want to please God. Only the truth can set you free.
Sundays at Central make a difference in my life, in your life. Sundays at Central make a difference in my life, in my life.
The Central Church of Christ is a family-oriented congregation that believes that Jesus the Christ is the head of the church and that the Bible is right. We're comprised of a group of committed, imperfect people who are striving to walk with our Lord and Savior. Yes, Sundays at Central make a difference, but we want to ensure that we're impacting your daily lives. We're dedicated to making a difference not only in the lives of our church family, but also in our surrounding communities. Central offers several classes, ministries, and programs for people of all ages that we're confident will fit your needs. We'd love to show you why our congregation is the right church home for you. So stop on by and join us for worship service so that you can experience how Sundays at Central make a difference.
Welcome to Central Church of Christ, where Sundays at Central make a difference. Jesus loves you, this we know. Sundays at Central make a difference. Come on, stop on by. We want to show you love. Come on, stop on by. Sundays at Central make a difference. Come on, stop on by. Come on, stop on by. Sundays at Central.
All right, good afternoon, everyone. We're going to get started, and I welcome everyone who was able to join us this afternoon as we bring forth information about women and heart disease. As we know, February was Heart Month. It's also Black History Month. Busy time, but we wanted to take this time to share with you some information about heart disease. So we'd like you to please welcome the nursing students from Coppin State University, as well as the Dean, Dr. Tracy Mary, the Dean of the School of Nursing at Coppin. And I'm so thankful that so many of you were able to join us and log in today. Dr. Mary will bring greetings in just a few minutes. I just wanted to first talk a little bit about why we're here today. So the Red Dress Sunday event. Understanding that for over a decade, St. Agnes Hospital in Baltimore, Maryland has promoted Red Dress Sunday. And it was a chance for congregations to educate and advocate for heart disease and prevention. More than 170 congregations in the region have hosted Red Dress Sundays as a part of this national Red Dress movement, sponsored by the National Heart, Lung, and Blood Institute and the National Institutes of Health and U.S. Department of Health and Human Services. And I'm so thankful under the leadership of Dr. Mary that Coppin, we've been able to come to Central Church of Christ over the last, I was thinking the other day, like how many years it's been. It has been about 6 years or so that we've been coming to Central Church of Christ to share some information about women and heart disease. And we're hoping that it continues to be something that is of value to the members of the congregation. Dr. Murray, did you want to bring greetings?
Yes, I would like to. Thank you so much, Dr. Harvin. And I want to thank all the individuals along with our relationship with Central Church of Christ for being able to have this event. And I was thinking that as well, and time passes by, but we will have to do a historical count to figure out when we really did start this initiative. I know this year makes 5 years for the passing of my husband, so I know it's been a little bit longer than the 6 years, but it is just a tremendous, great partnership and an opportunity to bring information to the community. and also to the church, Central Church of Christ. I also want to thank the nursing students who will be here today, who will be providing information and that linkage between women's health as our focus, but we want to also understand that beside the women are men or their significant others. We want to make sure that they're taken care of as well, and that this information will resonate, because 1 in 4 individuals still die from heart disease. So it is still something we have to make sure we take care of. We also want to deal with health equities and inclusion of all peoples so that we can make sure that this issue goes away. As we know about people for color, 23% of the individuals are impacted from cardiovascular disease. Women are impacted, about 23% of those individuals overall, and of course, men, 23.9%. But I thank you all, your students, for all the time that you've put into this presentation. I look forward to hearing about more information. I always learn something from each of your students, and you always bring a new insights and a new dimension and a way of presenting the information. So I thank you for your interest and also for putting this on today. And I thank Central Church of Christ, more importantly, for the partnership. And to the First Lady, I want to always say greetings to you, and you're a true blessing to all of us. Thank you so much.
Thank you, Dr. Murray. Appreciate that. I had to just say a little bit, want to bring a light to Coppin State University, reintroduce Coppin, excited about some things coming up, some new programs, and want to specifically highlight the School of Nursing, since we have our nursing students here today, to let everyone know that Coppin does rank 7 among nursing schools in Maryland. The NCLEX pass rate, which is that final exam that all nursing students have to pass in order to practice, we're at 84.62%. Our graduates from the program go on to do amazing things. They're in administrative roles, they are in law, there are some, at the bedside as well. And then the programs I wanted to mention, we have the traditional baccalaureate program, BSN, we have the accelerated program, we have the RN to BSN, the master's, which is a family nurse practitioner concentration, and then the BSN to DNP, which is a new program that we're really excited about, where students that have a bachelor's degree can actually go from a bachelor's degree to a doctoral degree. And then we have a DNP program. So just wanted to put a nudge in there. You're going to see how wonderful our students are. So for those who might be thinking about nursing school, or you have grandchildren or children that are thinking about nursing school, you may want to consider Coppin State. I'm going to start this off with a YouTube video. One of the students shared with me, and I thought it gives us a really good highlight. She's kind of reinforcing what we've said about why we're here today, and then we'll get started with the PowerPoint.
African American History Month is a very important time to focus on our health as African Americans. And as I mentioned before, heart disease is the #1 cause of death within this population. So why not talk about it now? And a lot of the risk factors are prevalent within the African American community. So I think African American History Month is a time that we celebrate our heritage, but it's also a way for us to come back and say, how do we sustain our lives? How do we live longer? How do we survive? We must increase awareness within this group, but we must also empower them to make health behavior change. Really, knowledge is only by itself if you don't take action. So the FAITH program, which stands for Fostering African American Improvement in Total Health, is an education program in which we went out to local African American congregations and educated them on the key cardiac risk factors, which include high blood pressure, cholesterol, physical inactivity, and poor diet. And we were hoping through the program that this would inspire and empower the community to place more emphasis on their cardiovascular health. And yes, I do see this as a template for other African American communities to promote health and wellness within their congregations.
Great. Can you guys hear me now? Can you just give me a thumbs up, my panelists, please? Okay, thank you. So women and heart disease. So in a nutshell, the presentation was talking about how we are integrating faith-based organizations and other communities, healthcare providers, to bring enlightenment, to make awareness of women and heart disease, and how that is actually helping with some information, but it still remains to be the leading cause of death among women. So this is what this PowerPoint kind of just summarizes, that information. So despite the awareness, only half, or 56% of women recognize that heart disease is their number one killer. Heart disease is the leading cause of death among women. And we know that African-American women particularly are at risk or have a higher risk for cardiovascular disease. And now the nursing students will start, and we're starting with Ms. Chinoso, who will kind of give us a highlight to help you guys understand what heart disease is. You ready, Ms. Chinoso? You can unmute.
Yes, I am. Hi, my name is Chinoso Wagu, and I'm here on behalf of my clinical group to discuss some information about heart disease. Just like Dr. Harvin said, Black women and also Latinas are at high risk for heart disease. And 1 in 3 women in the United States live with heart disease. It is the leading cause for death in women, which is very, traumatic, but you can move on, Dr. Harvin. What is congestive heart failure? So congestive heart failure is when the heart muscle contractility reduces and the heart is failing to pump blood at an adequate rate. So this makes it so that there's a reduced cardiac output in every person, and this becomes inadequate for us to meet the peripheral demands of our bodies. The signs and symptoms of CHF are shortness of breath, fatigue, a lot of swelling in your ankles and your legs and abdomen, and of course, weight gain comes with that. Some of the causes of CHF are heart attack, cardiomyopathy, some heart issues at birth, diabetes, high blood pressure, kidney disease, of course, being overweight, tobacco or recreational drug use, and some medications like chemotherapy, things that we use to fight cancer, can lead to heart failure. Coronary artery disease is just like I was talking about earlier, with inadequate blood flow to your heart. It could be a cause of what we call atherosclerosis, which is like a buildup of plaque in your heart, which does not allow for blood to pump effectively. Some of the risk factors for CVD are an increase in age, once again, high blood pressure, hypertension, diabetes, obesity, smoking. For women specifically, it could be a postmenopausal status or even pregnancy complications such as preeclampsia, when we have higher blood pressure during the later stages during pregnancy, which can lead to us having seizures, which can turn into eclampsia, gestational hypertension, gestational diabetes, and preterm labor, and also a hysterectomy. What are the symptoms? There is chest pain and discomfort, feeling weak or lightheaded, pain or discomfort in the jaw, neck, or back, shortness of breath, pain or discomfort in both arms or one arm or shoulder. And this is a map of New York City and DC and how many annual deaths we have per 1,000. As you can see, there's many. Thank you.
Thank you, Ms. Chinoso. And then we will have a brief time for questions and answers at the end. And we're going to go right on into Group CO5, and this is Ms. Price.
Hello, welcome everyone. I'm Shantae, and I'm honored to present for CO5. Go ahead, Dr. Harvin. Okay. So there are 3 types of prevention to help to eradicate cardiovascular disease and heart disease. The first way is primary Primary prevention is for people who do not have cardiovascular disease or are at a high risk for developing CVD because of their daily habits, but can be fixed earlier on before it gets worse. That includes lifestyle modifications and a low dose of aspirin. Secondary prevention involves detecting and treating disease or injury as soon as possible to halt or slow its progress, encouraging personal strategies to prevent re-injury or recurrence, and implementing programs to return people to their original health and function to prevent long-term problems. These are the recommended screenings and how often we should get these screenings. This is all a part of secondary prevention. Blood pressure, each regular healthcare visit or at least once per year if blood pressure is less than 120/80. Cholesterol every 4 to 6 years for normal risk adults, more often if you have elevated risk for heart disease and stroke. Weight and BMI during your regular healthcare visits. Weight circumference as needed to help evaluate cardiovascular risk if your BMI is greater than or equal to 25 kilograms. Blood glucose test at least every 3 years. And discuss smoking, physical activity, and diet each regular healthcare visit. Tertiary prevention. Tertiary prevention targets individuals already affected by CVD and is experiencing long-term effects. It focuses on increasing life expectancy and quality of life. It involves major procedures to prevent recurring symptoms, more costly and invasive than primary and secondary prevention, which is why it's so important to take measures to do it in a primary or secondary stage. And bypass surgery, stent, and pacemakers are ways that they can utilize tertiary prevention. Prevention is you have to be proactive. Don't ignore any signs or symptoms. Discuss and plan. Evaluate best options. Women go through a lot, and heart disease should not be one of the issues. That's it.
Thank you, Ms. Price. CO1, I believe this is Ms. Moore, or I'm sorry, Mr. Bose. Are you unmuted, Mr. Bose, and ready?
Oh, yes, I'm sorry. I was still muted.
So Mr. Bose will discuss pharmacological management of heart disease.
Okay. So some medications for cardiac vascular disease. We have loop diuretics such as Lasix, which assists with edema, hypertension disease, and pulmonary edema. We have a thiazide diuretic such as hydrochlorothiazide that assists with hypertension, heart failure, and edema. Osmotic diuretics such as mannitol assists with cerebral edema, which decrease intraocular pressure. And then we have let me see.
Your potassium sparing.
I'm sorry, it had like blanked out. This assists with hypertension, edema, and hypokalemia. Cardiac glycosides such as digoxin assists with cardiogenic shock and atrial fibrillation. ACE inhibitors such as lisinopril assist with hypertension and heart failure. And then beta blockers such as propranolol assist with dysrhythmias, chronic compensated heart failure, and stable angina. Calcium channel blockers lessens the heart's ability to pump if you have systolic heart failure and assists with hypertension, angina, and dysrhythmias. Anti-anginal, such as nitroglycerin, assists with chest pain and acute coronary syndrome. So some precautions to take. You should communicate with your provider and or pharmacist with any questions that you may have about the medications prescribed. Always communicate with your provider before deciding to stop taking any prescribed medication. Refill medications on time and as prescribed, and then use a marked plastic pill box with the days of the week to help stay committed to taking your medications. Some more precautions. Don't skip any doses. Be consistent to prevent your heart complications and prevent the body from building any resistance to the prescribed medications. Do not stop taking your medicine again, even if you think you feel better. Don't double up if you miss a dose, and then do not stop your medication without talking to your doctor first.
Thank you, Mr. Bowes. I know that was a lot of medication. Understanding that different medications are prescribed for different reasons. So you may have a diuretic, as that was mentioned, like your Lasix, furosemide, to help get rid of excessive fluid. Many times that's if you're having things like the congestive heart failure. If the heart is not pumping, then you may have a backup or retaining of fluid. Then there are other medications, as she mentioned, that may need to help the heart to beat or to pump appropriately. There may be medications you need for pain if you have things like angina. So there are different medications and they're all going to function differently depending on what your problem is with your heart. And now CO3, Ms. Johnson is going to give us some non-pharmacological ways that we can treat or prevent heart disease. Ms. Johnson.
Yes, and sorry if my background is a little loud. My husband and I are working. We do not have any staff yet, so I do apologize. We can go on. Okay, so some non-pharmacological ways of preventing a myocardial infarction would be to have a healthy diet. Having a healthy diet can help lower your cholesterol, blood pressure, and preventing things such as diabetes and obesity. Also, having a schedule for regular exercise, 150 minutes per week. And it does not have to be very strenuous. It can be moderate intensity. And this can help lower your blood pressure, lower cholesterol, and help your weight. Also, you can reduce your stress. And reducing your stress helps to reduce your risk for heart disease and helps maintain your blood pressure levels. You can also avoid or stop smoking. And this can reduce the risk of plaque formation in your blood vessels. Also, limiting your alcohol consumption. Alcohol consumption no more than 2 drinks per week can also help.
So I know that some of you, we passed out the crossword puzzle today with the non-pharmacological techniques for the heart. And I said, okay, the first 6 people that give me this crossword puzzle completed will get a gift. And I have 5 here. So I have one, Sharon James, Doris Cook, Geraldine Day, and Alexis also, all completed their crossword puzzle. So there's 4 gifts coming your way next Sunday. And there's a 5th, there's 2 more gifts out there. So the next 2 crossword puzzles I get complete, the gifts are yours. Thank you for completing that crossword puzzle. Thank you for doing the crossword puzzle for us, Ms. Johnson. So I want to provide some information about women and heart disease and menopause. I'm not there yet, ladies, but I know it's coming one day. And we do have a lot of signs and symptoms and things that bother us during menopause, but wanted to shed some light on menopause and heart disease. So we know there are hormones that are regulated, or that keeps things regulated, right? And estrogen is one of those. We do, when we go through menopause, you have low estrogen levels. So how does that relate? So estrogen can actually increase your risk for clotting because it doesn't have that progesterone that works with it like it should. And it does that because research has also shown women who are postmenopausal also have high levels of LDL. And if y'all remember, that low density protein is what transports fat to the rest of the body. So we end up having all this fat, and that fat becomes plaque. And then, as the students presented earlier, the increase in plaque, the increase in that cholesterol, then there's a problem with blood flow, and you can end up with these problems of the heart, this heart disease. So some of the good things about this is some of it can be manageable, right? So just going through menopause does not mean you're going to have heart disease, but it can put you at risk. So some of the things you can do is lower that risk by doing the things like the low cholesterol, the diets, the exercising, the decrease in stress as much as we can. And then if you have other risk factors, like you have a history of heart disease, hypertension in your family, you have hypertension right now, you smoke. So those other things put you at a higher risk of having heart disease during menopause. So we just want to be mindful of that as we go through these stages with menopause, that those things can happen or put us at a higher risk. There was also some research that related dementia, so cardiovascular disease and cognitive decline in postmenopausal women. So this was a research that was done by the American Heart Association. So some things we want to do is also with our memory and our thought process and eating healthy diets and engaging our brain and our mind with things like crossword puzzles, which is what you use today to help with that. So I just wanted to bring those things to everyone, so that would be more information that you would have about women and heart disease that may relate more to where you are in your stage of life. And now we have some fun, ladies. We're going to try a game. We want to see how much you were paying attention. First, Ms. Warren is going to give you a little bit more information. And then, so those who have been coming to ladies class, you already know we've used your phone before and you've logged in and you've done a game, but we're going to do another game. This one I think you might like. It's more fun than the one we did on Tuesday, actually. One of the students came up with this one. It's Kahoot. So you guys are going to play a game. She's going to give you some information and then she'll give you instructions. The floor is yours, Ms. Warren.
Hello, everyone. And I want to say thank you for Coppin for giving us the opportunity to come and speak on behalf of the heart disease of women. I'm going to talk a little bit about the causes of heart disease. I'll give you some answers to the game, so pay close attention to what I'm saying because this will help you score high on the game. So there are many causes that contribute to heart diseases. Some are the family history, plaque buildup in arteries and blood vessels, blockage of nutrients and oxygen to the heart. Heart disease is the second leading cause of death in the United States. There are 3 risk factors that heart disease cannot be controlled, such as age, sex, and your heritage. Heart disease can have an effect on pregnancy, such as rheumatoid heart disease is the #1 cause of cardiac disease in pregnancy. Some risk factors that can cause the heart disease during pregnancy are hypertension, diabetes, alcoholism. There are many statistics that has proven that heart disease in pregnant women can cause an increase in the risk of maternal mortality. The most common sign of a cardiovascular disease in pregnancy are congenital cardiac anomalies, which develops before birth, valvular disorders, when one or more of the heart valves does not open or close properly, And women can reduce their risk of heart disease by exercising, maintaining a healthy weight, managing their stress, limiting alcohol, and don't smoke. So right now we're going to play a Kahoot. I'm going to share my screen so you guys can participate in the Kahoot. I'll give you the directions so you can be able to log on to your phones to participate in the Kahoot. So to participate, you will have to go to Kahoot.it, and then you'll place the pin that you see on your screen, which is 443-4706. And once we have a couple of participants, I'll start the game. When I did not mention that at the end of the game, whoever wins, it is a gift card to what is the place called? It's a gift card to Chipotle that I'll have to give to Dr. Harvin for the winner.
Chipotle, well, they can get the low sodium option. So it looks like you have a couple of people. Okay, you have 11 people, 12.
Okay.
They're logging in. You said Chipotle gift card, and now we have more logging in. Okay.
Okay, I'll start the game in 1 minute just to give someone else a chance to log in.
And I see in the chat, people are telling me they did their puzzle and they just forgot to give it to me. Oh goodness, I'm gonna have to go buy more gifts.
Okay, I will begin the game now.
Okay.
The first question is, what are the causes of heart disease? And here are your choices.
I guess we have no sound. So it looked like all 11 people have answered.
Yes.
Okay, so you have no sound on your end either. Okay. Oh, who's High Tide? High Tide is in the lead, 908. Okay. Next question.
Your second question is, what foods does not cause cardiovascular disease?
What foods do not cause cardiovascular disease? I have to make songs since it doesn't have sound. Now they were paying attention. Okay. Tata still in the lead? Oh, she is.
This is a true or false question. Birth control are contributors of heart disease.
Okay. Had a couple of people who weren't paying attention, but high tide is in the lead still, huh? Yes. Okay.
The next question is, women can reduce their risk for heart disease by following which of these lifestyles?
Is there more than one answer?
Yes.
Oh, okay. High tide is on a roll.
Yes. High tide is really doing a great job. There are 3 risk factors for heart disease that cannot be controlled. Which are the 3?
Three risk factors for heart disease that cannot be controlled.
Question 6. What are some risk factors that causes heart disease during pregnancy?
Is anybody gonna ever
Okay, we
catch
have
up?
a new winner in line. It's Lisa.
Uh-oh, Lisa. Okay, Lisa.
We're moving on up. We're on question number 7. What is the number 1 cause of cardiac disease in a person that is pregnant?
Oh, not too many got that one right. They didn't hear that one, Miss Warren. Uh-oh, did that bring Lisa down? Oh, no, Lisa's still in the lead. Okay. Well, who's TJ? TJ Steph has the highest.
This is a true or false question. Does depression play a role upon developing heart disease?
Does depression play a role upon developing heart disease? Okay, Lisa's still in the lead.
Lisa is still in the lead. Which of these are contributors of heart disease? Me is now in the lead.
Is that you, Ms. Warren? Is that you? You to me? You playing? No? Okay.
No, I'm not playing. I'm not
Okay.
playing the game.
Now me is in the lead. Okay.
The most commonly seen cardiovascular disease in pregnant women is congenital cardiac anomaly and valvular disorder. Is that true or false? This is worth double points. Heart disease in pregnancy increases the risk of, and your choices will come.
Heart disease in pregnancy, increased risk of. Okay. It's more than one answer, right? Uh-oh, high tide back.
We have 4 more questions to go, guys. And this is a true or false. Men with diabetes are more likely to develop heart disease than women.
Everybody should get that one. It's women and heart disease.
High tide takes the lead at question 12. 3 more questions to go. Which of these symptoms should alert women to see their primary health care provider? And the answer was all of these above. Contributing factors to cardiovascular disease in pregnant women.
Sister Cook, I see your hand. I'm gonna grab all the questions as soon as this game is over. Looks like we have one more question left.
And this is the last question.
Uh-oh.
It's a true or false. Heart disease is the second leading cause of death in the United States.
Now, among women or in general?
In general.
I'm gonna do y'all like y'all do me for the test. In general, ladies and gentlemen, not women specifically.
Let's see who won the game.
High tide. Who won? Oh, Lisa ended up coming up. Uh-oh, who's Lisa?
It's gonna
Oh,
give you the
oh, it's
number
giving-
one person.
Oh, Lisa is, so we got number 1, 2, and 3.
High Tie is the number one person.
Okay,
Thank
High
you guys
Tide.
for playing our Kahoot. Thank you guys for playing our Kahoot. I hope this was some information that you were able to retain and you learned something today. So to the winner to High Tide, you will get your gift card. I'll give it to Dr. Harvey. And thank you for playing our Kahoot on the causes of heart disease in women.
Thank you, Ms. Warren. Wait a minute. I want to know who Kai and Lisa is. Who's number 2 and number 3? Because I see Ebony is High Tie. Who was number 2? Lisa? Who's that? Kiara. Okay, and who was number 3? Ebony, Kiara. Who was the third one? Lisa Stansel. Yeah, so we're gonna get 3 gift cards to a restaurant. Because you said Chipotle, right? I might pick 2 more, but I got you. I'm writing these names down. So we have 3 winners. Miss Wise, Sister Stansel, and Ebony. Thank you, Miss Warren. I appreciate you and your game.
Thank you.
I am so sorry there was no sound. We had to figure out how the sound thing, but she had all kind of bells and whistles on her game that we were not able to hear, but that's okay. We got through. So Sister Cook, you had your hand up. Did you have a question while we were going through? And I think the way this is set up, you may have to type it in the chat. I'm not sure if you'll be able to actually speak because it's set up as a webinar. I'll just see. Oh, thank you, Sister Stansel. She said that was fun and very informative, Ms. Warren. So before we close out, I just want to say to everyone, thank you for taking the time. And this was totally student driven. So they came up with the things that they wanted to talk about, the games. So hopefully it was informative. We want to continue this partnership. And so if there's any suggestions, any feedback, please feel free to provide that. I'll actually be sending out a link where you can do a little survey just to give us your feedback. If there's more information you wanted to hear, something that you would like us to do, hopefully soon we'll be back at the building and be able to do like blood pressure screening and actually do some hands-on education and activity with everyone. And I'm hoping the students will see the importance of, once they finish school, of actually reaching out to the community and helping to change these health outcomes, especially for African American. So we see a lot of, oh, thank you, congratulations, ladies. You all did a fantastic job. I'm just reading from the chat. Excellent job, everyone. They're saying thank you. Oh, sister, you completed your, oh, okay, so that's good. I was waiting for 2 more people to complete that puzzle, so I wrote your name down, Sister Sharon Johnson. I got you. Great to see nursing students partnering in community education. Awesome job. Everyone is saying thank you, ladies. Yes, thank you. That was Sister Cook saying thank you to the students. And we appreciate each of you participating. I know it's busy on a Sunday, but we just really didn't want the month to go by without doing something to share some information about heart disease. As 2 more messages. I learned more this year and enjoyed more than wearing red dress. I was laughing out loud. Thanks to all the students, very impressed. Thank you. Oh, wait a minute. I can't allow people to talk or use the Q&A to put in the question. I can allow people to talk. I'm learning how to use the webinar platform. I'm sorry. So if there's anybody that would like to say something or need to say something, you raise your hand and I will figure out how to get to you. If not, I'm just reading through the chat. And then I'll let Dr. Murray bring any closing remarks and we'll let you get on with the rest of your Sunday. Another chat says, excellent session, very informative. Thank you all for your time and hard work. Dr. Murray, did you have any closing remarks?
Yeah, I want to just say thank you to the students again, and also to you, Dr. Harvin, for continuing to bring this forward and making sure we make sure at Coppin State University, as well as Central Church of Christ, the importance of cardiovascular heart health. It is so important. I also thank all those people that participated and like chiming in on the chat. And I thank the students for your creativity, your ingenuity. I see many ways we can also integrate things into our own teaching, learning experiences. And just to understand, y'all are future leaders of the world. You are going to be able to really take this moment, and you are going to be able to, in your nursing career, remember it, and you will be engaged in the community in many ways beyond this. Because as you know, if you link this to cardiovascular health, but also COVID, you think about individuals who have been impacted because cardiovascular disease and COVID came together and impacted their lives and possibly impacted their health, and maybe also in a negative way. But just know I cherish this time with y'all. I cherish the opportunity to be able to hear what you're learning and how you're implementing it. It's more important, because knowledge is nothing if you don't share it. So continue to share. And I thank you so much again, Central Church of Christ, for your input, your support, to the First Lady, and also to all of the other individuals on the line. We love you.
Thank you, Dr. Murray. Again, yes, thank you, students, for all your participation, for being excited, for taking time out of your Sunday too. Much appreciated. Thank you for all those who participated. Enjoy the rest of your day. Have a good one.
My name is Willie Rupert Jr., minister for the Central Church of Christ. Over the past year and a half, we have offered boxes of food to our community, thousands of boxes. And of course, December is the last month for our food giveaway. But it's not the last time we seek to meet the needs of the community. We offer such ministries as our men's ministry, our ladies, as well as the mid-single women, not to count out our seniors services, along with our marriage, youth, or activities. And of course, our grief to offer encouragement to the communities during difficult times just like these. We want to encourage you to take part and be a part of all these exciting ministries we offer to the community. Thank you for the privilege of allowing us to serve over this period of time. And we invite you to worship with us 10:30 on Sunday, as well as Bible study at 9 a.m. We again thank you for the privilege to come into your home to share and to reach out to you and to serve this community. May God bless you. Worship with us. God go with you.
Edmondson Village. Come on, stop on. Yeah. 4301 Woodridge. Come on, stop on.